I'm just going to go to the end of this. So in December, when I was taking all that macrobid, I developed a systemic inflammatory response syndrome. So they call it SIRS for short. And all of this that I've been talking about with the high eosinophils and high basophils and high basophils while on Xolair, latent reactions to allergy shots, to all these medications that are giving me respiratory side effects. Still a cough. Damage to my lungs, gastroparesis, etc., etc., etc. My pulmonologist is pretty sure it's related to EGPA, which is an eosinophilic disease, and it's called like eosinophilic granulomatosis, polyangivasculitis. I don't know. I can't pronounce everything. I haven't learned it all yet. So EGPA is a pretty rare phenomenon, and the treatment for it is Fasenra or Nucala, and steroids as needed, because the deal is that it starts out with sinus infections, which I had years ago. I had those 6 sinus surgeries. I had, a fungal infection in my sinuses. I had osteomyelitis in my sinuses. And then it seems to have some neurological. So then EGPA is like 3 stages. So it's like sinus infections, neurology. My gastroparesis is neurogenic, most likely. And then it starts affecting your organs, aka lungs. So, and other organs like your heart or your kidneys. So there's stages as the disease progresses. And so I do not have much organ involvement at this point in time. I have my stomach. I think that's the big thing, and maybe my GI system, meaning my intestines, but I don't know for sure. So yes, so I mentioned that treatment is another biologic. I'm really on board with this diagnosis because when I put my timeline together, everything points to it. And although it's a diagnosis that really sucks to have, it really sucks. The one great benefit that I'll get out of it is that if I actually have a label for what I have, I can tell doctors how to prescribe, like what my limitations are and what I can take. For instance, I could have told the ER doctor that I have EGPA and that I think I'm having a systemic inflammatory response syndrome event with the macrobid, and he may have listened to that, or he may have said, I don't even know what that is. And I will be able to put together a safety plan for me. So for instance, I'm on blood pressure medication, and everything that they keep giving me is making me cough because all these blood pressure medications have respiratory side effects. Well, guess what? If I have an EGPA diagnosis, I can go to my primary care provider and say, I can't take any medications that have a respiratory side effect, period, end stop. So I'm really looking forward to advocate for myself once I get this official diagnosis, which I think is going to happen on Tuesday next week, and then I can move forward with some sort of a safety plan for me, and I will be in a better position to advocate myself. So sorry it's such a boring ending. EGPA is a rare disease, and I'm learning as I go, so I can't tell you all the details yet, but I'm going to wrap this up now because you guys have listened to me long enough, and thanks.